Dark Ages, and as you mentioned, Maimonides, Abu Bakr, Al-Razwa, these were sort of the enlightened heads at the time. Now, around 1600s, there was a birth of experimentation, a birth of science, and William Harvey, born in Kent, in England, he joined a medical practice and became sort of a student of his own science. He refused to believe the prevalent views of the time, and rightfully so. 1500 years had passed after Galen, who was a Greek philosopher and a physician. And the ideas that were put forth by Galen, the ideas specifically regarding anatomy, circulation, they didn't really make sense. But that was the status quo, and ideas of good and bad humors, and ideas of bad air that would cause certain ailments, they didn't really stand true to experimentation. And what Harvey did, amongst many things, being the predecessor of surgery, was that he questioned everything. And of course, as any revolutionary, he was always in trouble. But one of his major contributions was understanding of the circulatory system. So
how the blood pumps to the heart.
Exactly. For 1500 years, we believed that blood comes from the liver. And we didn't really understand the contribution of the lungs. What physicians thought was some air and breath of life was inspired into blood from the heart, and the right and left part of the heart communicated in order to oxygenate the system, and the blood would come as tides. And what Harvey did was real experimentation, where he would open a living animal and put a tube into the heart, and he would see that as the heart would contract, the tube would spit out blood. And then he did some basic math, and he figured out that the amount of blood that would squirt out of the heart would be a very high amount if that blood did not circulate. So then he proved that theory just by using basic mathematics. And he did not stop short at sort of accepting the status quo. And it's because of him now that we not only appreciate circulation, but we also appreciate experimentation, and more importantly, details of real anatomy. He did not believe in what was just sort of the status quo. He wanted to see it for himself.
Right. Now let's fast forward a couple more years, because something more important happened in the 1800s, and that was when bacteria was discovered. So how did this come to be? Where did this realization happen?
Well, this is actually a fascinating story.
I want to hear it.
Ignaz Semmelweis was a Hungarian-born physician who practiced in Vienna. And imagine this setup. You have a hospital in Vienna that takes care of a lot of women who try to give birth. And there are two wards. One ward is taken care of by nurses, and the other ward is taken care of by doctors and residents or students. Now imagine, back then this was normal. About 80 women a year died during childbirth or shortly thereafter on the ward that was taken care of by the nurses. 80 versus 800, 600 to 800 in the ward next door that was taken care of by physicians. And patients were randomized. One day they would go to the nurses' ward, one day they would go to the physician's ward, and the mortality rate was clearly different. Well, Ignaz Semmelweis figured out that it was the lack of hand hygiene that occurred as all these doctors and residents
were not washing their hands.
Were not washing their hands after doing anatomical prosections on all the dead women. And they would run from the morgue up to delivery without washing their hands. And the same bacteria, or, Ignaz did not realize the word bacteria. He realized that there were particles that the physicians carried on their hands. And the reason why he figured that out was because his partner, or one of his students, during the prosection, stuck himself with a needle and died thereafter with the same symptoms of puerperal fever that all the women died from.
So the same bacteria.
Exactly. Now the sadness of the story also comes from the fact that when Ignaz Semmelweis figured out that actually he and his physicians, his group, were responsible for the deaths of all these women, he lost his mind, and he spent the next 30, 40 years talking about clean hands and pushing the idea of using chlorine and boric acid to clean hands. Yet his manner and his loss of ability to communicate properly with his colleagues was a disservice, because in the end, no one believed him, no one wanted to question the status quo, and he ended up actually dying in an insane asylum.
And don't you use boric acid when you?
We don't use,
No?
so we use chlorhexidine, which actually is related, the chlorine component
Right.
is related to what Ignaz Semmelweis wanted his residents and his doctors to use.
We're gonna get into so much more when we come back, and we're gonna dive into other medical history as well. We'll hear about the spine specifically and how different spine conditions have been treated over the years. You're watching the Health Channel, all health, all the time, on South Florida PBS. If you have a question for Dr. Brucevanik, please call in using the toll-free number 855-796-4475. And be sure to visit our website, allhealthtv.com, where you can watch the Health Channel live 24/7 or check out videos from previous episodes like this one. We'll be right back. We're doing like a virtual class. This is amazing. Emily, we talk about the penicillin. Okay.
Alright, we're still on Facebook. I mean, YouTube Live.
Yeah, so then we can kind of go in after the phone number, and then, because we're talking about bacteria, bring up Alexander Fleming, and then do the package, right?
Cool.
This sudden movement can literally cause
See or no,
the brain
Emily?
to bounce around or twist in the skull, stretching and damaging the brain cells and creating chemical changes in the brain.
You hear me?
No, is that these chemical
talking too early.
changes make the
Um,
brain more sensitive
well,
to
after the phone number, hold on.
injury until it fully recovers.
She said she doesn't want to talk to you because you're late.
Hey, I wasn't.
Hey everybody, this
Where's
is
my
Gavin.
segment too?
I've seen firsthand the effects of pancreatic cancer. My
What are you looking
mother,
for?
who was considered very healthy, is diagnosed with stage 4 pancreatic cancer. I first heard about Los Garden right after.
Okay, so then after the phone number, go straight into, to that. Yeah, please put in the prompter. And then we'll finish the bacteria resistant. This is really interesting.
Yeah, and it's like there's so much, it doesn't stop, there's so much crazy stories.
Why did I think they use boric acid? Because you always do the extra cleaning that no other surgeons do.
Right, it's true. I was going to talk about this guy, the woman, Dr. Sanger, who came out with the pill. We were going to talk about how do we know where digestion occurs? Well, at the border between America and Canada, there was this physician, I'm sorry, I forgot his name, who saved a Native American that was shot. And this Native American was left with a fistula in his stomach. So this physician would take food, tie it to a rope, throw it in the hole, wait for it for, let's say, 5 hours, 10 hours, and then pull it back and look for different stages of digestion. I mean, there's a lot of these crazy experiments. I mean, William Harvey himself, exhuming body from the cemetery for his experimentation. I mean, really crazy stuff, you know?
Well, how else are we supposed to learn, right, at that
Right.
time?
And
So Da
then,
Vinci used to do. He used to open bodies up so that you could draw the muscles. and
that's
stuff.
right, which
That's how
was,
we knew about muscles.
which was heresy.
Interesting.
Which was heresy, right? You were not
You
allowed
could not
to do
do
that.
that,
In
right.
fact,
They were
up
after
until
me.
William Harvey, experimentation on dead bodies
Right.
was big taboo.
Right, exactly. 1 minute.
And now it's
Yeah.
the norm.
No, it's a must in some countries, but not in most countries.
Well, it's because of religious reasoning why
Right.
they don't do it.
Like Republic of Georgia, not a very religious country, not a Muslim country,
They're allowed to do that.
no cadavers.
Oh, yeah.
But what if you have, if someone who's Muslim comes to America to study medicine, or someone from one of these countries studies medicine, and they're in,
They can do it here.
can they
can't
do it here, or are
That's a
they,
good question. I
are
don't
they
know.
prohibited from
I think
religion?
they're
That's a
allowed to
good
do it
question.
here. I think they just for religious purposes they don't allow it in their country.
Right, but I mean, it's also, they're still religious as individuals, so I wonder if they come here and they study medicine.
Very good point. I wonder.
15. 10 seconds.
That was sad about that, about him killing himself.
Eight,
He lost his mind,
5,
basically.
4,
Yeah.
3, 2.
Welcome back to the Health Channel, all health, all the time. I'm Kathy Buccio, and with us is Dr. Gosha Brucevanik, spine surgeon with Baptist Health South Florida. If you have a question for Dr. Brucevanik, please call in using the toll-free number 855-796-4475. Now this hour, we're talking about the history of medicine and how it's led us to where we are today. So since physicians were starting to learn more about bacteria at this point, there were antibiotics that were discovered, mainly penicillin. So talk to me about how Alexander Fleming plays into this role.
All right, so Scottish-born scientist. I think he was like the 8th child of 9, he was kind of a very quiet, sort of not a very outspoken man, and he changed the world. During World War I, as the soldiers were carried back to the barracks, those that survived, a lot of them would die within a day or 2 or 3 as the wounds would fester and they would die from sepsis. And that really affected Fleming. A lot of the work that he did actually was done in the United States once the Rockefeller Foundation sort of held him up, and it was really sort of per chance that he discovered penicillin as a little petri dish, which is a little plastic circle that is frequently used to culture bacteria, started to grow mold. Now, most physicians would see that they would throw the culture away, but what he saw was that the bacterial cultures next to the mold changed color and then just sort of evaporated. And then he was able to harvest that mold, and through research over the course of 50 years thereafter, penicillin went from the strength that was discovered by Fleming to something that's about 1,000,000 times stronger, but the same chemical. So it went through stages. First, they had to learn how to make penicillin synthetically, and then was distributed, I think, first by Eli Lilly, one of the major companies. And then really, that's a pivotal moment in medical history when we learned how to save patients from infections.
And he laid the groundwork for that discovery as well.
Exactly.
Wow. Now, did you know a lot of the early research, as Dr. Bruce Evonik was saying, on penicillin was pioneered here in the United States? So take a look at this video from the U.S. Food and Drug Administration that explains how some of the history behind this antibiotic worked.
Penicillin was discovered in England in 1928.
Have you seen that they're trying to cure certain diseases now by infecting people with other diseases?
Of course.
Yeah, I didn't know that.
That's huge.
Yeah,
But they're not really infecting it with other diseases.
So that from that question, so no bacteria becoming resistant, correct?
Central Illinois have nearly everything.
Okay, you got it.
Penicillin production, everything that is except for the right fungus strain. The final piece of the puzzle arrived unexpectedly on a piece of aging.
Yeah, they said like go infect somebody with measles.
But inactivated, obviously. That's called a vector. And you use that as a mechanism of sending a genome, like a virus, who will then affect only certain kinds of cells.
Right.
It's very targeted.
Right. Exactly. And it'll get rid of those certain types of cells.
Yeah.
They'll treat that thing.
Where is that?
You'd have a product, then private industry would be.
Oh, you took it off?
But you can't guarantee it, this is science. And so it was very
Okay, for
appropriate
spine
to
surgery.
come to a government.
You changed
law
in the prompter?
Where riskier science can be done.
Oh, gotcha, thank
Producing
you.
penicillin was critical for treating service members during World War II. And so began a medical revolution treating life-threatening infections and illnesses that continue to this day.
At age 3,
30
I
seconds.
contracted nephritis, a lethal
Kevin Ford is
kidney
next.
disease, and only with massive doses of penicillin did I survive. So I owe a debt to ARS
15.
because of the work they did with penicillin.
The original penicillin strains are still here in the
Nice.
ARS Culture
10
Collection
seconds.
of the National Center for Agricultural Utilization Research in Peoria,
Stand by.
Illinois.
5,
for the
4,
US Department
3,
of Agriculture.
2.
I'm Pat O'Leary.
This is absolutely fascinating, and so much has changed. So how has treating bacterial infection evolved since the first introduction of antibiotics?
Well, new antibiotics have been discovered. Sulfa antibiotics sort of appeared around the same time with penicillin, and since then we've expanded further and further. But bacteria has evolved as well. So at this point, we have many different classes of antibiotics, but we can no longer reliably say which antibiotic covers for which bacteria. So now we collect samples, we send them to the lab, and then we look for cultures and sensitivities. And then once we know from the cultures which antibiotic will affect the bacteria the most, that's the antibiotic that we give to patients.
Right, because bacteria becomes resistant
You
to
got it.
certain antibiotics as well.
You got it, yep.
Now we're going to transition because I want to focus on the spine, and as we know, back pain is very common. So for how long have we been treating back pain?
Well, look, there's evidence that even back in the times of Egyptian Empire, scoliosis was addressed, and whether it was braces or crutches, where we have evidence they had crutches.
Even pharaohs get back pain, right?
Exactly.
Yes.
But the real sort of evidence-based treatment of backs probably doesn't start until the middle of the last century. The first spinal operation was done at the turn of the century in the, I think, early 1900s.
Wow.
By this physician whose name was Hibbs. And most of spine surgery back then was centered on deformity, not back pain, and specifically deformity that's associated with tuberculosis, which is a very prevalent and very virulent disease. The operations were grandiose, grotesque, requiring a very long recovery. We would take bone and wire it to the spine in order to sort of get the bone to mend together. A lot of these operations failed, but back then this was really all that physicians had.
Wow. So when did fusions come into play?
Around the same time, so we knew that an infected knee, for example, if it's infected and destroyed by infection, is best off in a fused state, an
Right.
immobilized state, where you take away the articulation. And the rationale was extrapolated to the human spine. So we knew that if there was a big phlegmon, which means a big infected pus bowl, you would empty the pus and then attach something that will stabilize the spine and make it very rigid. Eventually, the mobile parts at that section would disappear, and that section would just be rigid piece of bone forever.
Right, but it's pretty safe to say whether with fusion or back surgery, the risk of infection and death was very high at the
Very
time.
high, yeah, absolutely. So, surgery back then was taken much more seriously than it is today.
Now, I want to spend a couple of minutes talking about some of the most famous spine surgeries we've seen in history. One prominent historic figure is John F. Kennedy, and he actually suffered from severe back pain. Is this true?
So, interesting story with JFK, and a story that we actually see in a lot of patients today. He had some back pain. Diagnostics, MRI wasn't available back then. He had sort of a substandard study that we consider today called an air myelogram that revealed, according to his original surgeon at Harvard, that he had a bulging disc, and he ended up having what's called a discectomy. There are some of the studies that were taken of his spine available for review.
Right.
And it appears that over time he continued to have degenerative changes. He went on to then have an old style fusion, I believe.
4 surgeries he had.
Right, multiple surgeries at Mayo Clinic, a fusion that failed. He had a long open wound with an infection, and in the end, he was given methamphetamines as pain relief. So really, sort of every step of the way was not what you would expect
So
today.
if he would come see Dr. Bruce Abonic, he would
Sure.
not have had all these steps.
Right, so he would have never had an air myelogram, he would have had an MRI. He would probably not have had surgery. I would have sent him for injections and he would have gotten better. He would have never had the surgeries that he had, and if he did, most of these surgeries nowadays have an expected good outcome of in the high 90s.
So imaging was a big game changer when it comes to back and spine care.
Absolutely, absolutely. So really like around 70s, 80s, where we started to use an MRI is where things truly changed, because prior to that, all we had was x-rays. And there was really not enough information you could gather from x-rays, because most young people suffer from soft tissue issues, soft tissue problems like nerve issues or disc issues, and x-rays really don't show that. Now, look, it's funny, but today, if a patient has severe back pain and they go to the ER, they're not going to get an MRI, they're going to get a CAT scan. Now, it doesn't make sense, sort of, for lay people, even for me sometimes, but there's a rationale for it, where we worry about fractures, we worry about cancer. That's what the function of the emergency room is. Once we know that that's not the case, patients leave the ER not really feeling much better.
Right.
We know that it's nothing dangerous, but they're still suffering, so MRI is really the way to go.
Now, the advances that we've made in medicine and surgery over the past hundreds of years has led us to where we are today. And up next, we'll be talking about where we are now. And later, we'll hear about what we can expect in the future. You're watching the Health Channel, all health all the time on South Florida PBS. If you have a question for Dr. Brucevanik, please call in using the toll-free number 855-796-4475. And be sure to visit our website, allhealthtv.com, where you can watch the Health Channel live at 24/7 or check out videos from previous episodes like this one. We'll be right back.
All right.
And all these awesome examples, we aren't going to talk about them? All these awesome examples, Gloria Stefan, George Bush.
What was wrong with that?
Do you want to?
What-
Up to you.
I'm ready.
Examples of what?
Of their back injuries that they've had. Remember when, I don't know if you remember the Gloria Stefan? They told her she would never walk again. She had spine trauma. Then George W. Bush had disc problems and had surgery for them. Peyton Manning.
Father and a
Dang
husband.
it, man.
I'm a professional golfer.
And went on to win another ring.
Right.
I fight.
That's
And Gloria Stefan's still doing the conga, so we're good.
Is she?
Yeah, she's fine. I mean,
Does
she
she
went through
still
some
sing?
tough
I
times,
mean,
but she's fine now.
It's also one of the most.
Have you been to her restaurant?
So you can
Their restaurant?
Which one?
Her overpriced restaurant.
Yeah, what's it called again?
The new one, a Stefan Kitchen. The one that designed it. But she has Larios, her famous one.
But the new one is where the waiters and stuff sing, right?
Yeah, they used to do that at Pearl, their old one, Bongos.
Oh, okay. Oh, Bongos is theirs?
Was theirs, yeah.
Oh.
Sorry, go ahead.
And when your kid has it too.
Maybe, hold on. Let me see where you're going here with this part. Well, I guess that I would love to. I mean, I feel like maybe we need a history of medicine part 2. Because it doesn't make any sense to bring it into
I
now.
was just thinking about how they used to use leeches to clean wounds.
Well, Emily, you're just gonna have to write another segment.
That's pretty crazy. You can still do that.
You know, we could do a segment just on outdated
Yeah.
medical treatments,
Outdated.
like leeches,
We were
bleeding,
talking earlier about discovery
you know,
resistant
emetics,
bacteria.
cathartics,
Oh, right.
uh,
You mean like
where they used to drill holes in the skull.
Right, yeah.
There's so many of these
Cranial,
crazy
Can
treatments.
you change the prompter if you have chance?
One thing I feel like
Okay.
Like the braces and stuff.
Well, yeah, she had
Knees,
the,
like the Forrest Gump stuff.
it's true. So she had to
To
wear
get
like one of
rid of
those
all
back
the pumping.
braces.
You could definitely do a whole show on outdated medical treatments.
Let's do it.
Yeah.
That'd be fun.
We'll probably put some people out of business.
Dementia is not a specific disease.
Can we get one
It's
of
an
the top
overall
or?
term that
Huh?
describes a wide
Quit
range of
the
symptoms
top.
associated
Why?
with
For new age,
other thinking skills,
I think she's being
severe
sued by a
enough to
couple
reduce a
people.
person's
Really?
ability to
Yeah, because
perform
they do like a lot of
everyday
new
activities.
age.
While symptoms of
you know,
dementia
like
can vary greatly, at least 2
California
of the
style.
following must be significantly
Hippie
impaired to be
stuff.
considered dementia.
That's what I was
Celebrity
thinking. That was
stuff,
what I was looking for.
basically.
That was what I was looking for. That
Ability
word.
to pay attention.
You know, like if you eat this certain thing, it's gonna like
Perception.
I
Well, she
rejuvenate
had
yourself or
the-
something.
that famous egg.
Yeah, that's what
Contact your
I don't know what that thing was.
I don't know what that was either.
Evaluation
It's
to
a major
make
Some group
thing.
egg, hold on.
Ego egg.
No, it's like an
30
egg.
seconds out.
Is it- Oh, she was fined $145,000 for its claims about its yoni eggs.
145 is nothing. That's nothing. That's like a half
That's
a
just
day to
one
work for her.
claim, that's just one claim.
And Vascular Institute saved my life.
Stand by. In 5, 4, 3, 2.
Welcome back to the Health Channel, all health, all the time. I'm Kathy Buccio, and with us is Dr. Gosha Brucevanik, spine surgeon with Baptist Health South Florida. If you have a question for Dr. Brucevanik, you can call in using the toll-free number 855-796-4475. All right, so we are really fast forwarding here. So let's talk about where we are now in
Sure.
medicine in terms of healthcare as well. So just to put it all in perspective, we have a graphic that shows some of the key advances in medicine. So doctor, can you walk us through these and explain their impact in medicine today?
Absolutely. Well, vaccines is the only way that we can battle viruses. So that was a game changer. Clean water and improved sanitation, you know, is a big change from the days of the plague, you know, where 2/3 of Europe perished, Antibiotics was a game changer, absolutely, in the early part of the last century. Anesthetics is why we can do surgeries in the first place.
I wanted to ask you, as you were giving examples in the beginning of the show of earlier medicine, what was used as the anesthetic?
So, whiskey and bear down and just hold it. Then it became ether, which was very toxic, and in the main auditorium at Harvard, there's actually the old droppers where the physician, the anesthesiologist, would fill it with ether, and then drop by drop, slowly drop it on a piece of cotton that was sitting on a patient's face to keep them out of it.
My goodness.
But once we've learned gases and once we've learned IV treatments, I mean, it changed the world. That we can fix things now that we could never even dream about fixing in the past.
Absolutely. Now, let's talk about resistant bacteria. We touched on bacteria in the beginning, but what is resistant bacteria?
Resistant bacteria is a mutated form of old bacteria that is no longer susceptible to the same antibiotics. So the common example is Staphylococcus, which is everywhere. That's the most common cause of infections.
That's strep, correct?
Well, that's another one.
Okay.
That's the second most common. So, but the same would apply, Staphylococcus or Streptococcus.
Okay.
Staphylococcus bacteria has evolved to be resistant to penicillin, and we say methicillin because that's the associated name, and you'll hear an acronym MRSA, methicillin-resistant Staph aureus. And not only is this form of Staphylococcus resistant, it's also more virulent.
Right.
And in Miami, for example, about half of infections are from MRSA.
So what causes this resistance then?
So, nature will evolve. We're killing bacteria with antibiotics, and nature will find a way. And humans continue to evolve. We continue to look for stronger antibiotics. So we can battle MRSA now with an antibiotic called vancomycin, which is why I use vancomycin powder and IV in surgery, because you don't really know whether you're colonized by regular Staphylococcus or MRSA.
Right.
So it's interesting that when surgery is done with NSAID only, which is kind of an outdated antibiotic, it's like having no antibiotics at all if you are colonized by MRSA.
Doctor, would you blame it as well an overprescription of antibiotics?
It's hard to say. It's hard to say because we, in general, in medicine, blame patients.
Right.
And that's not really right. We talk very little about the fact that our cattle is treated by antibiotics every day, and serious antibiotics, and not just the sick animals. All the animals are treated by antibiotics. Now that will produce some strong resistance. Now we like to blame mothers who give antibiotics to kids who don't really need it. And look, the reality is that I don't know the effect and the contribution of those both equally erroneous uses of antibiotics. But I think what's most relevant to the viewer is that not every condition requires antibiotics, and since majority of, for example, upper respiratory infections are caused by viruses, antibiotics will do nothing. But keep in mind, antibiotics have risks. Outside of resistance, antibiotics can kill your normal gastrointestinal flora and cause other super infections. So I would use antibiotics really judiciously.
And we have some information from the World Health Organization that shows some of the dangers of antibiotic resistance. This one being infections are harder to treat, and this is something you just mentioned.
Definitely.
Longer hospital stays, which is not ideal. This is, we always want our patients to be home, correct?
Absolutely. And look, at some point, something that would be common 100 years ago and unacceptable now it's happening more and more, which is you could be in a hospital with an infection and the doctor may say to you that there's nothing else that we can do. Now, that was the norm before antibiotics. Now we're like, what do you mean there's nothing you can do? Well,
Right.
That's the reality of virulent, resistant bacteria. There may be nothing that we could do.
Now, more and more doctors are researching ways to prevent antibiotic resistance, and we have a video from the CDC that explains more on this. So let's take a look.
2 minutes.
That's what I was told when the kids got lice. We all ended up getting lice, like 2 summers ago or last summer, and they're like, and Coco kept buying, you know, old school, when you got lice, you would buy it at the store and that thing would burn your scalp and all of them would die. And we bought that and we ended up having to go to a lice troopers. It's a place just to go get lice treatment. And I'm telling the woman this and she's like, no, lice has evolved. And I'm like, what do you mean? And she's like, the lice itself is resistant to all the things that used to kill it. That, you know, she would explain exactly what we would buy as kids, like the stuff that would burn your hair, you scratch. She's like, that doesn't work anymore. She's like, they're become like super resistant. I'm like, oh my god.
You know what that means? We just have to kill off all the people who have that lice.
That's everybody gets lice, but yeah,
We have to inject them into the space.
it's horrible. When she was like, I said to her, what do you mean resistant?
I'm getting itchy just talking about this.
The lice?
Yeah.
Oh, you're gonna experience it one day. Dr.
Really?
Russo.
With my kids, of course, right?
It's a
Oh,
rite of
yeah.
passage with kids.
Really?
Yes. Because I mean, kids.
Somebody
in
in your
public
kid's school
If they're in public school.
is gonna, well,
If
and
they're
they
private school.
and they have people that come in and do the inspections. But there's always one
They
kid
train
that
the
comes
teachers to
in
do it.
that has a lice, gives it to everybody else, and you know what I learned too? Kids sharing iPads. You know, kids sit on the floor and they share their iPads and they put their heads together. Those are the big culprits in schools when they sit and they're like on their tablets.
Apple is the problem.
Yeah, see?
Tablets are.
Tablets, well, it's more than tablets. And they send a letter home and they're like, check your kids with lice, and then those same kids come back.
So I was
'cause-
telling you yesterday about sunscreen, remember? When they say sunscreen causes cancer? It does, because people
it
think when they
doesn't.
put sunscreen on that they're protected. So it causes cancer.
What do you mean?
That's what people were saying. Sunscreen, 20 seconds. When
And
you
it
put
causes
sunscreen
cancer?
on, you think you're protected, so you stay out a lot longer than you would.
Oh, then you don't
So
reapply.
it causes cancer, yeah. That's what they mean by that. 10 seconds.
3 minutes?
Yeah, 400 T's.
Okay.
Stay by. 5, 4, 3, 2.
Remember, if you have a question for Dr. Bruce Sabonic, you can call in using the toll-free number 855-796-4475. Now, what else are we seeing now in terms of healthcare? Are we seeing an increase in specialized physicians that deal specifically with a certain ailment or a condition?
There's so many innovations. You know, doctors have kept medicine tied to their chest for centuries, and perhaps there were good reasons for it, perhaps to prevent medicine from being misused or do no harm. But we have evolved as a society, as a civilization. It's no longer a mystery that when there is a bacterial infection, you ought to take antibiotics. So the innovation is that medicine is now coming out of the pockets of doctors and going into the hands of the people. You know that legend of Prometheus who brought fire from gods, and at first it was Hippocrates who brought medicine to the people,
Right.
but held on to the science of it. And now what we're seeing is that you could sort of figure things out yourself. There's online sources where you can learn yourself and figure out what the right treatment is. And I think this is wonderful because for the first time, I think
Patients are involved
That's
in their
it.
healthcare.
for the first time, patients are able to second guess the doctors, which is amazing.
Right.
It puts doctors in a place where they have to do the right thing. They can no longer peddle voodoo.
One of the big innovations, especially in your field, is minimally invasive surgery,
Sure.
which is a huge game changer
Absolutely.
when it comes to surgery. Can you talk a little bit about that, and especially for spine and back?
So probably second only to the creation of anesthesia is the improvement associated with minimally invasive. So as surgeons, you know, in the past we have been sort of taught to open, fix, and close.
Right.
But it's not that simple, and there's a lot of morbidity that's associated with operations. So the newer generations of surgeons is being taught ways to perform operations without causing as much morbidity. We don't cut muscles anymore. Patients wake up, they have substantially less pain. They don't need as much physical therapy.
They don't need so much time at the hospital.
Exactly. So really, this new approach of sneak in, correct the problem, and sneak out has changed spine surgery with certainty, but most other surgical fields as well.
It's been incredible. Now we talked about the past, the present, and now up next we're talking about the future. And when we return, Dr. Bruce Savanek will share with us what's on the horizon for medicine and specifically spine surgery. You're watching the Health Channel, all health, all the time on South Florida PBS. If you have a question for Dr. Bruce Savanek, please call in using the toll-free number 855-796-4475. And be sure to visit our website, allhealthtv.com, where you can watch the Health Channel live 24/7 or check out videos from previous episodes like this one. We'll be right back.
Great.
Awesome. Anything that we didn't get to that you want to bring in or no? Emily? Yeah? Okay, good.
Studies out there. There's an easier way to see a doctor.
This is like medical history 101.
Mhm.
So like an express.
Baptist Healthcare.
It's insane.
Today to enroll for free.
Oh my gosh, to use whiskey into, like you see in the movies and they tie you down, they just have you bite on something.
So
As anesthetic.
this was the way to do surgery in Russia as early as 50 years ago
The better way to get better.
To do it like that way.
on children,
What?
because kids don't have pain. That was the idea, that kids, they'll just forget.
Every year, millions
Well, that's
of
true.
Americans.
In fact,
Emily's like, wait, what?
if you go to a lot of doctors today, pediatricians,
Do you hear that,
they
Emily?
will say, do surgery earlier because then you don't have to use as much anesthesia because it's kids. I mean, locura, right?
Locura. How do you say that in Russian? Loco.
Sumashestvие.
Sumashest. Oh my god, are you serious?
And get tested.
Well, it's kind of like when you think about how they used to allow people to smoke on airplanes. They still have the signs.
That what, that it was, wouldn't do anything?
What do you mean?
Well, no, it's like the same mentality, even something as simple as, I mean, we're Hispanic, you pierce your ears when you're born. You know,
People still do that.
Right, but for when you're in Hispanic, it's a cultural thing, you
Yeah,
do
because
it, but
they
it's
think you don't
also,
remember.
it's also the idea of like, well, you're little.
Yeah.
I'm not really gonna feel it so much.
Yeah.
I'm sure I felt it when I was that baby, but obviously I don't remember.
Yeah, you don't.
But that's that mentality. It's like, well, kids are not gonna remember. Well, kids can remember if you have a surgery.
Yeah.
You hurt them. That's horrible.
Especially with the bad surgery.
Horrible.
But look, it's the world of evidence-based medicine now.
Yeah, but you're still talking about something that you say happened 50 years ago.
Right, but this is an amazing time because no longer
It's an amazing time to be sick, guys.
because you can no longer peddle nonsense.
Right.
Patients are now smarter.
But you know what it is? You're not like every doctor who says.
Tell that to the non-vax
Well,
people.
no, but you're not like many doctors because what you said before, that you said it's great that patients are second guessing and questioning. Most doctors don't like that.
I don't know, but it's changing. You know, again, it changes from the paternalistic model where don't question me, this is what the doctor says, that's what you gotta do, to sort of a consultatory model now where, you know, I'm advising patients, I'm educating them so that
Right.
they can make the right decision.
Right, and where they can read, what's going on? Where they can read something and say, well, I read this, what does that mean?
Yeah, I like an educated patient. I like an educated consumer.
I like that one we did about when you're talking about resources you can look online, medical journals and stuff.
That's
good.
huge, yeah. And you could read the same articles the doctors should be
That's
reading.
what they're referencing as well. So
Right.
why don't you read it?
You
So
got
both
it.
can be on the same page.
PubMed.com.
Right.
As simple as that. Free.
15.
People don't know that.
Yeah,
Right.
people
Remember you said that in one of the segments we did?
10 seconds. People definitely don't know that.
No, I never knew
Go
that.
to the library anymore. 5, 4, 3, 2.
Welcome back to the Health Channel, all health, all the time. I'm Kathy Buccio, and with us is Dr. Gosha Brucevanik, spine surgeon with Baptist Health South Florida. Now, if you have a question for Dr. Brucevanik, please call in using the toll-free number 855-796-4475. Now, this hour, we dove into the history of medicine and how we got to where we are today. But medicine and healthcare will continue to evolve. So, in your opinion, what does the future hold for medicine in general? I know I put you on the spot. It's a loaded question.
What an exciting thing to answer. Okay, so spinal cord injury.
Okay.
We're gonna figure out how to fix a sick spinal cord. That's gonna happen. It's not gonna take much longer. And there's major advances in that field. We're gonna learn how to make weak muscles stronger.
Right.
Again, something that as of today we don't know how to do. And that's really relevant. And I'm not just talking about the biceps and triceps, I'm talking about your cardiac muscle. So that in a patient who's had multiple heart attacks, we could potentially make the heart stronger once again. We still don't know much about the brain. And you know, when you hear an inoperable tumor, you hear that more often with the human brain than anything. And I know personally some incredible neurosurgeons where I train who are at the forefront of a way to get into the brain in the least invasive way possible, without damaging anything else, correct the problem, and then sort of come back out using image guidance, robotics, and just the finest, most precise tools. The truth is, though, this isn't something that you need to, you know, you can tell your kids that they're going to see. This is what we're going to see this generation. Today, if you were to have a prostatectomy or cholecystectomy, you could have it done with a robot through tiny little, barely perceptible incisions. Today, we can treat spinal cord compression without making a single incision, just using very precise targeted radiation beam. Today, there are chemotherapeutic agents that don't hurt the patient and target precisely, just go after the tumor. So really, the future is today. The trick is knowing what's available. Because, for example, antibiotics, right? Something obvious, common every day here may not be available in a third world country today. So keep in mind that the distribution of medical knowledge lags behind tremendously once you go outside of sort of the centers, big cities, and you will see that permeation as well, and that really will change the world during our lifetimes.
I want to go back to your field specifically. When you talk about all these exciting innovations that are happening in medicine, do you think for someone, let's say, who's dealing with paralysis, the words "you'll never walk again" will be something we hopefully will never have to hear?
I'm confident that that's going to happen. Look, we are going to do full body transplants within our lifetime. As soon as we learn how to connect the myelin sheath, the covering of the nerves. And something that literally just came through, past 15 years we've been researching how to replace discs in the necks, and now that's sort of the standard. Now we have total disc replacement for the lower back. So patients with back pain who don't have and don't want who don't have degenerative changes, severe degenerative changes, who are not candidates for a fusion surgery, they can now maintain motion with these newer operations that now finally have a reasonable research behind them. So this is an exciting time to be alive.
We actually have a caller. We have Armando from Hialeah. Armando, are you with us? Good morning.
Yes, I want to say that a long time ago, I had a vision of the future, you know, for medicine, okay? And I think in the future, they're going to be able to clone vital organs. And each person's going to have their own, almost like what they do with blood banks, that they'll have a vital organ bank, and each person will have his vitals stored for them for when they need it. And I think that's going to be in the future because someday they're going to figure out how to clone vital organs, you know? So they won't have to do transplants anymore. And that'll probably solve the problem with the multiple organ failure that I've lost so many loved ones over that problem, you know? And God gave me that vision in a dream a long time ago that it's going to come true.
Let's ask Dr. Brucevonic's opinion on that. What do you think? Anything's possible, right?
Yeah, Armando, you're totally right. It's going to happen. We talked about this briefly when we talked about stem cells. So what we are learning alongside organ sort of cultures is how to control tissues. So you can send in stem cells, which are little babies, or you can clone an organ, but it's how do you train the body to accept it without suppressing the immunity? And that's also equally important, and that's happening as we speak. In fact, today we have a technique that was developed at Stanford where we can take a protein out of your blood, inject it into the joint, and slow down the rate of cartilage degeneration. In fact, early research shows upregulation of genes that make cartilage. That's the first time ever that we've been able to demonstrate growth of cartilage.
Is that stemming from the practice of PRP as well, or no?
It's definitely related to PRP,
Okay.
and it's sort of like the next stage after PRP.
That's interesting. Okay, but all these new medicine techniques, these innovations, they're going to need clinical trials.
Definitely.
So as we see a rise in that, what's the importance of having these clinical trials to bring this medicine to the forefront?
This is a hugely controversial issue. Look, take the pill, the original pill. When I say the pill, everybody knows what pill. It's a birth control pill.
The pill.
The pill was tested in Puerto Rico. That was the only place back then where they could do clinical research. And since then, many other drugs have been tested in Puerto Rico.
Right.
But what about the ethics of that? What about testing medications in third world countries? Is that breaching some kind of an ethical sort of guideline, taking advantage of those that would do anything for just a mere reimbursement, something that would be unheard of here? So the issue of testing and drug trials, medication trials, surgical trials is a controversial one. And to all the animal activists out there, like myself and like my wife, for example, this is not a black and white issue, because when a sick kid who's dying from asthma needs a new medication because he's resistant to anything else, you're not going to say, well, save the poor sheep, right? Because I don't want to test any more drugs.
Save my child.
Right, save my child, exactly. Whereas outside of that, you really want to maximize the care for the animals, and from an ethical standpoint, you want to provide them the most humane sort of life possible.
Right.
So ethics have to sort of evolve as well, right? So it's no longer just to rely on Hippocratic do no harm. We have to take the next step.
Right. It's not black and white. You're absolutely right. So then how do you get involved? How do you get involved in something like a clinical trial if, as you say, we're encouraging patients to do their research and they see something that, hey, maybe this could help me? Is it as easy as that?
Look, it's not. It's not. Because you have to know a whole bunch of background before you can sort of pick and choose your own treatments. I would say my best advice is second guess everything, question everything, and do your own research. Go to the website of the American Academy that oversees that specialty. So for example, for orthopedics, it's the American Academy of Orthopedic Surgeons. Verify the information that you're being told. When a patient is being told that you have a disc bulge, you may be paralyzed, question that. And there are some great resources. There's a website called PubMed, PUBMED.com, that has original research. You can read the citations, you could read the abstracts. They are not hard to understand, and you could see for yourself whether what you are being told is reliable and true.
Amazing. Now I feel like we need a medical history part 2. We only scratched the surface here, but that's about it for today. But I'd like to remind you at home that Dr. Brucevanik will be joining us again next Wednesday at 7 a.m. So stay tuned next week, and you get to ask all the questions that you may have. Thank you so much again for being here, Dr. Brucevanik.
Thank you.
And thank you for taking me back to school. Be sure to join us next time on the Health Channel, all health, all the time, on South Florida PBS. And follow us on Facebook, Instagram, and Twitter at All Health TV, where you can get health tips from our experts and see what's coming up on the Health Channel. You can also visit our website, allhealthtv.com, where you can watch the Health Channel live 24/7 or check out videos from previous episodes like this one. I'm Kathy Buccio. We'll see you next time.
All right. I'm gonna
Awesome
end the
segment.
live
That
show.
was great. It was really good.
Live is